Welcome, everyone. On behalf of the Centers for Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Supports webinar series. My name is Nicole Pino, and I work for Kaufman and Associates, and I will be your moderator today. Today's webinar is titled Unique Benefits of Animal-Assisted Therapy for Individuals in Long-Term Care. Please note this webinar series is supported by a contract awarded by the Centers for Medicare and Medicaid Services. The opinions, findings, conclusions, and recommendation expressed in this webinar are those of the presenter and do not necessarily represent the official position or policy of the Department of Health and Human Services or the Centers for Medicare and Medicaid Services. All right, so today's webinar series are to discuss skill, temperament, and training requirements for therapy dogs, discuss additional ways to incorporate dogs such as facility dogs and service dogs, describe the process for matching handler and dog teams with population in different care settings. Next, we'll want to explain how care settings can begin offering animal-assisted therapy. And lastly, discuss how to find a reputable therapy dog organization. All right, so I would love to introduce our wonderful presenters from the CHAMP Assisted Dogs. First, I'd like to introduce Pam Burke, who is the Executive Director, Martha Poland, who's our Therapy Dog Program Director, and Janie Von Wolsack, who's a Therapy Dog Handler as well. So Pam, please go ahead.
Thank you. Hi, everyone. I'm so pleased to be here today, and I'm the Executive Director for CHAMP Assistance Dogs. We are actually located in St. Louis, Missouri, but I'm going to tell you a little bit about our mission and what CHAMP does. CHAMP is an acronym that stands for Canine Helpers Allow More Possibilities. And CHAMP is a 501c3 organization, meaning we are a nonprofit organization. And we've been in business for 26 years. We started with 13 founders, and 3 of those founders are still very involved in our organization. And we place assistance dogs with people with physical and or cognitive disabilities. In addition to that, we have several other programs. One, of course, is our therapy dog program, which we will talk extensively about in the future. We also have a prison program, which is part of our assistance dog program, where women offenders in a nonviolent prison camp actually help us train our dogs. And we also have an education program where we go into schools and talk, and this would be considered an education program as well. I want to share our mission statement. I'm not going to go word for word here, but CHAMP basically trains and places assistance dogs to help people with physical and cognitive disabilities. The foundation of each and every one of our programs is based on the incredible canine human bond. So, and we empower people with physical or cognitive disabilities. Each assistance dog organization has their own specialty. Some, as you know, most people always think of a guide dog. Some people, some organizations train guide dogs. Some help with hearing disabilities. Some have seizure detection dogs that can actually alert a person when they're getting ready to have a seizure. We also have diabetic dogs who can alert someone when they're getting ready to have their sugar is dropping. But like I said, we help people with physical or cognitive disabilities. And just to share a little bit of a story, the man in this particular picture is a corporal from the Marines, and he was over in Afghanistan and was leading his men across a bridge and told them to stay back. And as he walked across the bridge, he stepped on an IED and lost all of his limbs. So when we meet someone, we ask them, what do you want your dog to do for you? And he primarily said the main thing he wanted was for his dog to pick up his credit card for him, because that was something that was nearly impossible for him to do. And when I asked him, is that all you want? He said, no, that's not all I want, but it's the most important thing. His dog, Hugo, is a public access service dog, and he can go anywhere that Todd goes. But Hugo is at home a lot with Todd, and Todd has a young son, and sometimes his wife wants to go shopping, and she can leave Todd at home. Hugo opens doors for him, lets him go up the doors with his wheelchair. Hugo also can open the refrigerator and bring Todd something from the refrigerator. It's just amazing the difference that he can make. And Todd actually wears a mechanical arm and hand. And sometimes that particular hand will drop off of the arm, and the dog, Hugo, can pick that up and bring it to him. Or if the battery pops out of his prosthetic arm, Hugo can pick that up and bring that to him as well. So that's just something that about this story, just so you know what our dogs can actually do to help their person. Our vision statement is very similar to our mission statement. Both partners, dog and human, have a better life because of the other. And that again refers to the canine human bond. We place dogs with children, adults, and veterans. And this little boy actually has a lot of anxiety, and his dog, Marshall, does not go to school with him, but he makes a huge difference for Emil. And Emil's mom and Marshall wait for him every day when he comes home in the school bus, and Marshall greets him. And Emil's in a lot of pain, and Marshall is there for him and really helps soothe that pain and makes him feel better. Okay, Champ Service Dog Program. We start training our service dogs, and I'm not kidding, the second they're born. We have people called whelper helpers who actually stay with the puppies for the first 8 weeks that they are born, after they're born. They take shifts, and they are handling the puppies, taking care of them, making sure that the mother doesn't lie on them or anything. So they are socialized very, very well from 8 weeks of age. And this is people's favorite job, just to watch these puppies grow up from birth to 8 weeks of age when they go to their puppy raiser. Just a little bit about Champ Assistance Dogs. People always want to know what it costs to train and place a service dog. Currently, it's running about $35,000 for us to place one dog. And our costs just keep going up like everything else. Inflation has made it very difficult for us. And so we do a lot of fundraising over the year to raise funds to actually help place these dogs. Our puppies, immediately when they're 8 weeks of age and they leave the whelper helpers, they go to someone called a puppy raiser. And that puppy raiser has that dog for 2 years, teaching them and working with them. They come into the office and work with our trainers, and then they are placed with someone. And it's hard for those puppy raisers to give up those puppies, but you know what? We make it very, very easy for them to get to know the people the dog's going with. And if they decide to keep a relationship with that person the dog's placed with, that is up to them. And it's wonderful for them to see the difference that the dog makes for those people. Okay, assistance dogs. We actually train dogs to be public access service dogs. That means they can go in any facility, any public facility, like a restaurant, a theater, stores, anywhere that they would like to go. And then that's what most people think of when they think of a service dog, public access. But something that we have done that has worked extremely for us, if a dog is a little bit barky or doesn't like other dogs, whatever, they can't be a public access service dog, but they can be placed in the home with someone and be a home service dog. And that dog can make a huge difference for a child or an adult that stays home a lot. Again, they can open doors, they can turn lights on and off. And for a veteran with PTSD, the dog can go in the room prior to the person going in. They can turn the lights on. They can be there with that person and just make them feel a lot more secure. Towards the end of the training, the dog is matched with a likely partner. And sometimes we'll take 2 or 3 dogs in to meet someone. And it's amazing how those people can bond with the dog immediately. One dog will go in and nothing really seems to happen. Next dog we take in, it's an immediate bond. And that's kind of how we decide which dog goes with which person. We also place facility dogs. Facility dogs are trained and they have the same skill set that an assistance dog has. The difference is a facility dog is a lot more like a therapy dog. They are placed with a caregiver in a facility and they live with that caregiver. They go to work with that caregiver and come home, have vacations with that caregiver, everything. They get to be a dog when they're not working. Same thing as a service dog. We place facility dogs in places like schools with a school counselor. We have facility dogs that actually go to work with someone who works in the hospice care, palliative care. The dog is not only there for the patient, but often with the palliative care, when a nurse is talking to the family about what their loved one is going to go through, the dog is there to help comfort them. We place them in courthouses and also child advocacy centers. These dogs can be in the courtroom behind the witness box with a child or an adult that's telling a very difficult story. And that dog can just place their head on their laps when they're behind the witness stand and they can have that comfort. And it really makes a huge difference. But this is something that works really well for elderly care, especially in a hospice situation. This is a home service dog that we placed. This was actually a rescue dog that we trained, and she is placed with Fran. And Fran has some real issues as far as walking and balance. And her dog, Olive, is trained. She lives with her husband, Fran, but if she falls and needs assistance, there's a where command where she'll say where, and Olive will run and find her husband and bring him to where she is to help her. So that's just another command that these dogs do and make a huge difference. Okay, and these are home companion dogs. This is a girl named Julie, and this is her dog, Wrangler. Julie is actually nonverbal. She has a communicative device where she can talk to Wrangler and give him commands. The main thing that these dogs do is provide comfort and love and help with anxiety, but it also gives this person who has had to have someone take care of them and help with every need they have, gives them some independence, and they can give the dog commands, which makes them feel wonderful. They take care of feeding them, they can take care of some of the grooming, and it makes a huge difference for them. So that is a home companion dog. Assistance Dogs International is a worldwide organization that accredits service dog organizations. And every 5 years, they come in and actually look at everything that the organization does. And they actually say, yes, you're accredited for another 5 years. And CHAMP was the 16th organization to become accredited in the United States. And now it's a worldwide organization. And we always suggest if you are going to get a service dog, it's a good idea to always get an accredited organization. And you can find out if an organization is accredited or if you're looking for a service dog, you can go to assistancedogsinternational.org and you can look by geographic location and it'll list all the accredited organizations and what they do. Are they, the assistance dog organization? Do they place guide dogs, seizure detection? You can find that all on their website. And if you ever have a question, feel free to contact us and we'll help you with that. Okay, at this time, I'm going to pass this over to Martha Pollard. She is our director of the Therapy Dog Program. And thank you for your time.
Hi, everyone. Thank you. I'm so happy to join. We wanted to talk a lot today about our Therapy Dog Program because it's an easy to access assistance method to have dogs with different populations and different types of facilities And it's the easiest one for the facility because there's not that commitment where someone there has to keep the dog in their home or anything like that. These are dogs for our organization and most others that are pets that belong to people who choose to volunteer. And they bring their dogs in for training to be therapy dogs. And it takes a certain dog, a special dog for that as well, which we'll go through. So CHAMP therapy dogs visit people in adult and pediatric hospitals, nursing homes, adult and child daycare centers, rehabilitation centers, schools, colleges, long-term care facilities, and more. You name it. We get calls from all kinds of different, we've attended celebrations of life, we've attended funerals. Sometimes when there's a funeral for a family that is very dogs are an important part of their life, or sometimes if a child or teen passes away, they like to have therapy dogs present to help comfort the people in mourning. And so that's one of the very special visits that we do. Therapy dogs have been shown to increase engagement, improve mood, lower blood pressure and heart rate. And really, it is amazing and moving to see how people light up upon seeing a dog. Sometimes people express deep emotions during therapy dog visits and reminisce about their own pets. So it's not uncommon for us to hear that people go on, a volunteer might go on a therapy dog visit and a person might break down emotionally or light up or engage come out of themselves because they light up from the dog. So that's just one of the wonderful benefits of having a therapy dog program. So prerequisites for becoming a therapy dog, the pictures you see here, the bulldog, that's the student in our current therapy dog class. His name is Watson. And on the right, we have Tango. She's a recent graduate. We do not have breed restrictions at CHAMP. Dogs are evaluated on their skills and their temperament. We don't worry about really what their history is or what their breed is. Therapy dogs to be evaluated must be about 2 years of age to enter the training program, sometimes a little bit younger. And they have to have lived with their owner for at least 6 months. So if someone has a rescue dog, they have to have had the dog long enough for the dog to feel comfortable with the person and at home, and their transfer stress to a new environment, which many dogs have, not all, but is handled by the time they come into the program. Not a CHAMP, and the dogs have to pass a skill and temperament evaluation before admission into the therapy dog program. They demonstrate knowledge of basic commands such as sit, stay for a minute, down and down stay for 3 minutes. They have to walk nicely on a leash, and they have to come when called. And those basic commands are things that we don't have time to teach in a 12-week therapy dog class. So the dogs really are well trained before they even enter the program. And then throughout the training, they demonstrate those skills to get into the therapy dog program in a non-distracting environment. They make our office as quiet and distraction-free as possible. But of course, on visits, they can hear everything. They hear people rushing up to them. Someone could call a code in a hospital. There could be any number of alarms and sounds and smells. So as they go through their training, we add and add and add distractions for the dogs so we can assess how they will do in different types of environments. Temperament testing we also do besides this. We try, it just takes about 10 minutes, but we try to mimic what a dog might encounter on a therapy dog visit, like an unexpected sound, an unexpected sight. We will have someone walk with a sombrero on, big hat, maybe glasses, a big towel over themselves, so that they're an unexpected or unusual silhouette to see if how the dog reacts to something or someone that looks different than something that they've seen before. And we do what we expect from a dog is they might react and be startled by an unexpected noise or something like that. But what we're looking for is a dog that will quickly forgive. So most of the time, one of the examples is we have some cookie cutters in a tin. So someone walks by with the dogs and we'll go ch-ch and make this noise. And the dog's startled, that's fine. But then most of them are like, "Ooh, what was that?" And they want to come sniff and investigate and wag their tail and see who you are that made that noise. That's the ideal response. If a dog is really thrown off by that, gets very nervous, upset, frightened, we will stop the evaluation because we don't want to stress the dog. And that dog either needs to be worked with additionally or is not a suitable candidate for the therapy dog program. As I said, we have no breed restrictions. The dogs are evaluated on who they are. So the training program for CHAMP and similar organizations is a 12-week, it's 12 weeks of 2-hour classes, which is a lot for the dog and a lot for the people, but we do have a lot of material we cover, and the emphasis is safety for visits. And so we put the dogs through as many environments as we can and situations. In this picture, this is a student named Kelly. She's walking her dog, Charlie. And these are two of our instructors in the wheelchair and pushing her in the wheelchair. So of course, Nola in the chair is not walking Charlie, but she might feel like she's walking Charlie. We'll get into that a little bit in another slide, which is very beneficial for people. The dogs are taught different exercises. A lot of dogs don't really realize they have a back end. And so they get into a situation, maybe there's a patient bed and a chair and an overbed table, and the dog can get in there to get up to the patient, but they don't know how to get back without kind of being a bull in a china shop. So they learn how to maneuver in small spaces and approach people. We do eye contact exercises. And the humans learn how to interact with people and dogs in different environments in a safe manner as well. And the humans have to continuously assess their dogs for signs of stress. We want the dog to be happy, we want the human to be happy, and the patients that they're visiting or people that they're visiting to be happy as well. So any dog, even in a familiar environment, can have a stressful day for one reason or another. So we want our people to continuously be aware of their dog, and if the dog is exhibiting signs of stress, they will exit the visit early, take their dog out for a break, for a potty break, or whatever they need to do. Sometimes they even need to change the facility where they visit. For example, we had a person who visits a cancer center, and her dog was unhappy and kind of nervous visiting patients actually getting infusions. And we suspect it might have been, we didn't smell anything, but of course the smell of the chemicals and medications is evident to the dog. So that particular dog had to change venues because they were not happy in that environment. Also part of our training is that we invite guest speakers to attend. We have a wonderful volunteer who uses a power wheelchair. She comes in and talks to the classes and helps teach classes, and the people can see how fast those chairs are, how heavy they are, what it's like to approach one. And Jennifer is just wonderful with working with the dogs and giving them that experience. We have people who are communications experts. We have one here today, and teach us how to speak respectfully with different populations. And as terminology and I don't know, just the way you address certain people changes, etiquette changes over time. We want to make sure that we are polite and don't accidentally offend anyone, and invite people to, and don't assume that people are unable to speak or unable to communicate. We want to encourage people to be able. So we have speakers who help our students with that as well. We too try to, as I mentioned, provide our students with as many training experiences as possible in different environments. During the course of training, students observe current therapy dog teams on visits so they can see what it's like. They don't take their dogs on these visits, but it gives them a great opportunity and really kind of gets them so excited. They're like, I can't wait till we can go do that. So they see the difference that it makes for patients and people that they visit, and get excited, kind of get ideas too of where they might want to go. They might go to a library and think, this is kind of low key. I'd rather walk around and see more people. They might prefer a hospital environment or something else. The dog classes that we have are taught by expert trainers. Our therapy dog trainers also teach our assistance dogs and service dogs. So they're very skilled trainers and that work with our therapy dog program. And anybody who's falling behind has questions, they're always willing to work individually with that person as well. We are very excited and proud to be able to partner with the Goldfarb School of Nursing at Barnes Jewish Hospital. They have a state-of-the-art simulation lab, which is just, it's 4 hospital rooms that look just like hospital rooms. They have mannequins in the beds that breathe, blink, speak, moan. It's really amazing. So we usually have a couple mannequins in those beds that are hooked up to monitors. The dogs are exposed to blood pressure sounds, hospital sounds. Even the people really like to work with us. The people who are employed at Goldfarb like to work with us. And so they'll even do things like put McDonald's trash or something, wrappers and trash cans. So the dog, because the dogs will encounter that on a visit. And what do they do when they walk past the trash can that smells like a hamburger? What is that? What is a handler going to do if their dog tries to go for that? So, we really make it realistic, and we're so thrilled to be able to work with them. And then, so we have our classroom, but then when they get into this environment, we have the room set up in a complicated manner. So we'll have volunteer patients in the bed. Sometimes this is Sandy Frew in this bed. She's one of our volunteers, and this is at the Sim Lab. There's Pam with her therapy dog, Paisley, visiting Sandy. But Sandy will sometimes be an ornery patient. She'll sometimes be difficult to reach. We'll have the room set up with furniture placed so that the student will walk up into the doorway, knock, knock, knock. Hello, would you like to meet my therapy dog? And it's okay, well, what are you going to do now? Because this patient has a drain, has a Foley bag. They're difficult to reach. They're on the other side of the bed. They have movement issues. So it's really a wonderful experience for them to be able to think through some of the situations they might encounter and how they're going to be able to make this a successful visit. These are just some pictures we threw in there. The top left, this is a library visit with one of our therapy dogs named Jax, who was so relaxed that the kids were able to put their book right on him and read to him. It's very helpful for children sometimes to read to dogs because they don't judge. They don't help them with the words. They just listen to the stories and let the kids be who they are. The bottom left is at a rehab center. This is our therapy dog, Gracie, and she visits the rehab center of St. Louis regularly. Middle picture is one of our new therapy dogs. That's Nico. And on the right is Linda. She's at Missouri Baptist Hospital with her therapy dog, Charlie, visiting patients. So we also use therapy dogs frequently for elder care facilities. A variety of communities, including Elder Care Alliance communities, offer pet therapy as part of their health and wellness programs. In addition to helping people with physical, mental, or emotional illness, pet therapy can provide fun and entertainment for seniors. And also many people appreciate the fact that pets are non-judgmental and capable of intense love and affection. Benefits of therapy dog visits for elders and others is they provide mental stimulation, decrease anxiety, help people with dementia recall memories and experiences that they've had with their own pets and others. They reduce loneliness. Some people live, are maybe lone survivors of their family or for one reason or another, rarely if ever have visitors. So the dogs and their handlers are always welcome. They trigger the release of endorphins and boost mood, and that effect lasts well beyond the length of the therapy dog visit. Reduce overall physical pain, and they can improve motor skills. Walking a dog involves using larger muscles in the torso, arms, and legs and can improve coordination. Rehabilitation center visits. This is Gracie again. You just saw her in a previous picture, and she's getting ready to walk with a patient who uses a walker. Now you can see the patient has a gait belt on and the handler is there with actual control. The handler has a green sweater, actual control of Gracie, and the person in the chair has a little extra leash that's in their hand and attached to an extra ring on Gracie's champ cape. And so Gracie will walk along. They learn this in class too, how to not get under a walker or get their feet under a wheelchair or things like that. So we hear stories often of patients cooperating with care or making great progress during visits because their focus is on the dog and not on their discomfort, loneliness, pain, or frustration. This is a quote from Cheryl. She said, when we made the Rehab Institute of St. Louis is what it's called, visit, not only did Gracie get to do double leash walking with a client at the rehab center, but the physical therapist asked if Gracie could walk backwards, and of course she did. That is something they learn in class as well. We walked about 15 steps backwards with the client and the client's walker, and then did a complete U-turn. So that was very cool. And Cheryl has another story at the Rehab Institute about a patient who was using a prosthetic limb, learning to, and of course was uncomfortable, nervous about falling, in pain, and the first day with their prosthetic on their walk, they walked about 10 steps. The next day, Gracie was there so that the patient was able to walk Gracie as we do. Of course, he's not really walking Gracie. She said he went all the way down the hall, did a U-turn, came back, went back, really walked way farther than expected, partially because he's walking a dog. There's something else to focus on besides your pain and discomfort. So it helps greatly. And that's it for our therapy dog program. We'll tell you a little bit more how about at the end, how to get a program like this in your facility. But I'd like to introduce Dr. Janie von Wolfsack. Janie has many years of experience as a CHAMP therapy dog handler and has done all kinds of visits. This on the right is Janie's little dog, Zoe. Zoe's also on her lap right now, I think, or was. And Zoe is just incredible, wonderful little dog. She's our smallest dog in our therapy dog program, has lots of clothes. She's a little fashion model, and she wears a she's so small she wears a bandana for Champ instead of a vest because we don't have one small enough. But anyway, Janie, take it
Thank
away.
you. I'm so glad to be with you today. Zoe and I, excuse me, I have the opportunity to go to assisted living, memory care units, and also adult daycare. We do a number of other things, but I know that that's the interest that you have today. When we go to assisted living, we were welcomed into the facility by the activities director, who during the first few visits walked with us to each person's room. And so we were introduced to everybody. As soon as she felt that we were comfortable with the facility and with everybody there, and they were comfortable with us, we were allowed to just come in at random, but we had an appointed date to go in every time. So those visits were really, really important. We were also had the opportunity to visit the memory care unit there. And because Zoe is so tiny, I have to be careful about who to put, whose lap to put her in. So I'm very careful about making sure the person's capabilities can handle a small dog. Zoe weighs about 5 pounds, a little over 5 pounds. And of course, she's a little fragile. In the memory care unit, Chris, the director there, would precede us to visit the people in their rooms. And she would go in and say, Mary, would you like to see the therapy dogs today? So that the person knew that the next people coming in were safe and they were comfortable with us. And it was always a great joy to be there. For some of them, it was just putting her on the bed next to them. Others would be sitting up and I'd put her in their lap. Others would, when I felt that there was physical issues that they would not be able to handle her, I would hold her and let them pet her. So, and then at the daycare center where we go, which is really one of the really interesting facilities, they too welcome us. They're ready for us when we get there. We know that we are welcome, and they usually have the residents sitting in a circle. We usually, in those visits we make with 2 other dogs. Those dogs happen to be really big dogs. And so Zoe she thinks she's the star because she's so tiny, and they think she's just the cutest thing that ever happened. You'll notice from the pictures, Zoe is a Yorkshire Terrier, but I keep her in a puppy cut because that makes it easier to give her a bath before we go places. When we visit the adult daycare, we go from person to person. And again, I can ask if they would like to have her in their lap. The look on their faces when I put her in their lap, and well, I often get the comment, would you turn around for a minute? I'm going to take her home with me, because they just adore having this tiny little pup. And then they tell me about their dogs, or dogs that they had 50 years ago. And I remember one lady who, every time I go, she asks me how old Zoe is. In fact, she does it several times while we're standing there, and she's petting her. So it is, we have to know how to handle a variety of reactions from patients, from the residents there. this last time that we went, I have to tell you about an incident that just was so delightful. And Zoe is a dog that will never lick your face, but she does like to lick hands, which reminds me, we do take hand sanitizer with us. And one of the residents there wanted her to lick her hand. And when she did, when Zoe licked her hand, she would go into gales of laughter. Well, the woman sitting next to her then joined her in the laughter. And she just kept sticking her hand under Zoe's mouth. And Zoe accommodated her, of course. She's very happy to do that. And it would send this woman into laughter. By the time we ended, all three of us were laughing. And I thought, what a joy to bring happiness and for so little time and so little cost. And I wanted to tell you about another situation where we've read the information about how dog visits lower blood pressure. I'd read all the research, I knew it. I was visiting a person in the hospital one day, and I knocked on the door and asked if they'd like to see the therapy dog. There were two nurses in the room, and so I said, "Oh, am I interrupting?" And I was ready to go back, and the nurse said, "Oh, no, please come on in." And I asked the person lying in the bed if they would like to see the therapy dog, and if they would like for me to put her next to her on the bed. At which point the nurse said, "Oh, Henrietta," I don't recall the name, I'll just call her Henrietta. "Well, why don't you sit up and pet the dog?" At which point the woman did. And she invited me to sit on the bed next to her and put Zoe in her lap. So while we were talking, the nurse said, well, while you're talking and petting the dog, why don't we take your blood pressure? And she did. And when she turned to me after she'd finished, she said, "It's 20 points lower than it normally is." I mean, I actually got to see that happen. And that's the kind of thing that you see almost all the time. The other thing that we see is, particularly in hospital settings and places like that, we see a lot of thank yous. But in assisted living and in memory care units, our thank you is the smiles on the people's faces more than it is an actual verbalization. But we also see it in the facility staff as they welcome us and send us on our way. We know that we will be welcomed back at any time. So if I were to wrap this up from my standpoint, it's when we are in a facility, having them ready for us to come in, knowing what time we're going to be there, and having things set up. If it's a situation like in the memory care unit where we need to go from room to room, having a staff member who knows the people to go before us to introduce us, no matter how many times we've been there, we are still strangers coming into their area, and we need that person to be the intermediary. And so that really is a very important part of our visit. The other thing is we ran into a situation in one facility that we were visiting where there was a facility dog that was not trained. And that facility dog was a distraction to our dogs who were trained to do their thing. And so we needed to have that dog either created or isolated in a room. And so it created a really a difficult situation. At that same facility, there was a person who brought her dog to visit a parent, and that dog was never on leash. So having a situation where any visiting dogs should be on leash at all times. And those are just some important things that I would pass on to those of you who are thinking about having therapy dog visits in your facility. It is a joy. We bring joy when we come, but I have to tell you, we with the dogs receive the major portion of that joy. We leave feeling so empowered by the love that we see the residents show these dogs. It's just absolutely delightful. And with that, I'm going to turn it back over to Martha, unless there's something else that I've forgotten.
I don't think so. That was wonderful. Thank you. I'm glad you shared your stories with Zoe. Your stories, like 2 out of 1,000 stories with Zoe. If you are, we work locally in the greater St. Louis and Southern Illinois area, and which I know you're not near us. So if you are interested in finding a therapy dog program for your facility, these are just a couple of things to consider. To do an online search for reputable therapy dog organizations. There are some that will, you can order probably a certified, I know you can order therapy dog capes on Amazon. You can order something that looks like an official My Dog is a Therapy Dog certificate. And so you really want to make sure that somebody isn't just coming to your facility and saying, my dog is a therapy dog, I'd like to do visits. You want to check out whether their dog is really certified from an accredited organization. I will clarify, we are ADI certified for our assistance dog program. They do not certify therapy dog programs. So the ADI certification is not part of our therapy dog program, but CHAMP takes our certification of our own therapy dogs very seriously. So one place to check out is the American Kennel Club. They have a list of therapy dog organizations. Another one is if you're working with a nonprofit, CHAMP is a 501c3 nonprofit, and many therapy dog programs are. Our visits are also free of charge, but that's something to think about. But Charity Navigator is just one. There are multiple sites where you can find information about a charity or a charitable organization you're thinking about working with to confirm that they are good stewards of their donations and finances, and they're rated on several different criteria. So that's one place to check that out too. And then there's a place called Therapy Dogs International. Website is right there. There are therapy dog organizations that do things other than what CHAMP does. And so that's a way if you're looking for any particular, like sometimes we'll get calls from people that might say, I have a pet, my dog is 6 months old. Can you train my dog to be my service dog? Or can you train my dog to be my therapy dog? We don't do that. There might be some other organizations that do. So TDI is a good source for finding different therapy dog organizations that do different things. So some things you'll want to ask the therapy dog organizations if you are inquiring about them. You'll want to know what type of skill and temperament requirements they have for their dogs, how long they've been in business as a therapy dog organization, how long their training program is or how many hours their training program is, whether they qualify and or train their dogs remotely or do in-person evaluation. I think in-person evaluation is important and in-person training so that the trainers, we have identified things over the years and over classes that sometimes people need extra work with something, and it's really a better evaluation of a dog to be in person. What qualifications their program instructors have. Our instructors are all service dog instructors as well, and what type of facilities they visit, whether they charge for their visits, whether they have teams available before you would want to, make someplace. Sometimes we have a waiting list. For example, we have more people who want dogs than we have dogs to visit. So you might have to contact a few to make sure someone has availability to do the kind of work that you're interested in for your facility, and make sure that their program is insured as well. A couple other things I thought of that I wanted to add to this list is grooming standards for their dogs. Different facilities have different grooming standards, but we do teach grooming to our therapy dog teams, and their dogs have to be bathed within 24, at least 48 hours before a session. Nails have to be short and smooth because it's so easy for a person to get their skin torn if they're an elderly person or have sensitive or tender skin for any reason. So grooming standards should be high, and then also health standards. All our dogs, all of our people are required to turn in proof of vaccination and veterinary care annually so that we know all the dogs are healthy when they visit. And that's it. That's it for me for our presentation.
If I can, I want to mention one thing I forgot to say. We are a 501c3 nonprofit. So I did tell you that it costs us about $35,000 to train and place a dog. We do place the dogs absolutely free of charge. And that is something you will find if you go to the assistancedoginternational.org website. All those organizations also place their dogs free of charge. And as Martha mentioned, our therapy dog program is provided to facilities absolutely free of charge as well.
Yeah, thank you. So this is our time for questions. So I did get a question in one of the chat, speaking towards, so the question is, speaking toward homes, nursing homes, do you have any studies on seniors at risk for falls due to Alzheimer's, dementia, or other diagnoses that contribute to impulsive decisions?
I am not, we do not, we would have to do a search for information on that topic. Pam, I'm not aware of any studies that we've done, although we're very aware of the fall risk and talk about that extensively in classes. And so, for example, if someone's in a walker, in the picture was Cheryl with the patient in the walker, patient had a gait belt. We would never take a patient on a walk or push them in a wheelchair without an attendant from the facility right there with the patient. And the patients never actually walk the dog or have control of the dog. They just have an extra lead. But we're very aware. We make patients, if anybody's using any kind of a balance assistive device, we ask them to sit before they do the visit and confirm that their device is within reach before we leave.
Amazing. I do have another question. So your webpage about the CHAMP therapy dog program mentions that you have a very special therapy cat. Could you tell us more? Is that cat particularly well suited to certain populations or maybe particular care settings?
Yes, that cat could go anywhere. That cat, actually, the person who owns that cat had to rehome the cat because of her dogs and the cat. So the cat is actually living with a different therapy dog handler at this time. But the cat's name is Dory, and Dory goes in a stroller. She has a leash and a harness, and she's the most laid back cat ever. So I would say it's probably not suited to most cats, but yes, Dory can sit on people's lap, or when she was visiting, she could sit on people's laps. She went to an outdoor visit at a college where there were teens everywhere, dogs outside, and she just sat on a bench next to her owner with her little leash on, and people come pet her, and she was very chill. So, but it's a rare cat, but in our program, of course, is a little bit different for cats, but the same standards as far as veterinary care, grooming, and so forth apply. So
We have made visits with Dory, and watching her accept dogs walk up to her and sniff her, she's just an amazing little kitty, big kitty. She's
Yeah.
big.
And some people, as you know, they're either dog or cat people, or they don't care for dogs, but they love cats. And this helps satisfy that. So many people, too, are just amazed how friendly she is and how
Yeah.
calm she is. So, yeah, it adds a little special spark to some of the people that have not visited with the dogs before.
Mhm.
Yeah, that's amazing. Another question we had come in, at what age does a therapy dog typically retire?
it depends on the therapy dog. When the dog starts showing, we just had a dog retire recently. We did library visits monthly for many years, but it was getting harder for the dog to get in the car, seemed to be in more pain. So we just kind of read the dog. There's not a specific age by which they must retire. Some as old as maybe 14 are still doing visits. Our oldest dog, Bella, she was a chocolate lab, did visits till she was 15. She did over 400 visits and just got slower and had more difficulty getting in the car. And her owner retired her and actually adopted one of our service dogs who needed to be rehomed. Now that dog's a therapy dog with her.
Yeah. Zoe is 14 years old. And so she still looks like a puppy because I do keep her in the puppy cut. And she's losing some of her skills, but when I take her places, she walks in like, oh my gosh, we're here. So I know that she still has that desire to be part of the program. And I'm watching her very carefully, as I told Pam and Martha, because as dogs age, they can become irritable. And so I'm very aware of watching that sort of thing. But right now she's having a good time. And like I said earlier, I didn't bring out her handkerchief because she'd think she's going on a visit, and then I'd be really, and she wouldn't be happy with me.
And the same thing as far as health. We've had three-legged dogs before, and sometimes that is really inspirational to people who can't walk well. We've had dogs who were blind, deaf, and sometimes it's a great animal to take into, like we have a deaf dog, to take in somewhere where there are people who cannot hear as well. Or, it's just inspirational to them to know that the dog can still do the same thing as everyone else. And it's a great thing.
Yeah.
So every dog's an individual, every cat. So we evaluate them on how they are and what they are as an individual.
Wonderful to hear. We didn't have a question, but I thought I'd share a comment. They just wanted to thank you so much for this presentation, and that they volunteer for the People's Animals Love in DC, and they're affiliated with the Lily and Early M Pilgrim. So CMS has been so valuable to us in our advocacy for institutionalized shelters. So again, yeah, we really appreciate you presenting today. And I think we do have just another couple minutes for questions. So if you haven't submitted yours, again, you can use the Q&A box located at the bottom of your screen, or you can also use the raise hand icon, and we'll unmute you and get to as many as we can. So I do see someone who has their hand raised. Tom, would you be able to help get them unmuted for us today? And Natalie, you are welcome to press the unmute button so you can ask a question.
You can also, I don't mean to interrupt, but if you would like to email us, you can email us at info@champdogs.org. CHAMPDOGS.org.
And Natalie, feel free to speak if you have a question. Oh, and I do see that she inputted it on the Q&A box too. She just wanted to thank you so much. She has severe chronic illness and was just talking to her family about getting a service dog. So I think this presentation was very helpful for her.
You can email us at info, INFO, at champdogs, CHAMPDOGS.org, ORG.
So I would actually like to thank everyone. I'd like to thank Pam, Martha, and Janine for joining us today. And in closing, I would like to remind everyone that today's webinar was recorded and that the audio and presentation slides will be made available online at cms.gov. Thank you again for joining today's webinar. And this concludes our session today. Thank you, everyone.
Thank you.
Thank you so much.
It was a delight.
Thank you.
Thank you.